finding was that we saw a decrease in our readmission rates among those patients who had a recommendation and the clinician or provider agreed with that recommendation. That was primarily in those patients that were on a medical service team, and in both those who didn't have any underlying illnesses as well in those with underlying illnesses. We initially had thought we had seen an impact in length of stay on a decrease in hours, but that ended up being really similar across all groups, which from an antimicrobial stewardship program perspective is very encouraging as well, as these recommendations and us intervening on patients isn't also leading to negative consequences such as increasing length of stay. A physician or provider orders an antibiotic, and 2 days later our program, if they're receiving one of these antibiotics, comes by and reviews it for appropriateness and duration, dosing, and decide if we're going to stop, change the medication and such. Total data set has, in that cohort, is over 14,000 patient reviews. By excluding patients that were in the intensive care unit, such as the PICU or NICU, as well as those on the hematology oncology unit, and then excluding those who might have had more than one of our stewardship program reviews, we were left in this analysis with 7,000 patients. So we think that's obviously maybe one of the larger data sets in regards to especially pediatric antimicrobial stewardship. Of those 7,000 patients, 1,240 of them received a recommendation. Our most common recommendation by far is stop the antimicrobial. And what we always do is we go and talk with the providers, and this is what we believe should happen, agree or disagree. We captured that aspect during the data analysis and during our interactions with all the providers. So when you come down from that aspect of it, now we have patients that we review on a daily basis. Some receive recommendations, some do not. I will say that in general, about 20%, 18 to 20% will receive a recommendation. Of those who receive a recommendation, there's another 18% that will disagree with those recommendations. From a length of stay perspective, if you look at just if you received a recommendation or didn't receive a recommendation, those length of stays were all similar except for in the patients that had a chronic care condition and were a medicine patient. In those cases, those who received a recommendation actually had a longer length of stay. If you then look at that same group for readmissions, right? So you received a recommendation, not whether you agreed or not, but you received a recommendation, and then we looked at readmission rates. The readmission rate actually was less in those who had received a recommendation. It was not statistically significant. It was, I think, 7% versus around 4%. But again, it had some kind of, whether that's clinically relevant or not, I think will have to be determined. When we look at that on a length of stay basis, at that point, all the lengths of stays were similar. There was no excess length of stay. If you just look at like the healthy children, their lengths of stay were a median range of 79 hours for those who agreed with the recommendation versus 82 hours for those who didn't receive a recommendation, or who disagreed with the recommendation, sorry. Just look at the medicine patients, both the complex chronic care condition, or those that have chronic diseases, versus those who are healthy. There was actually no readmissions in the agreed group. And there was a 3% readmission, I think, in the healthy group, and around a 4% readmission rate in the complex chronic care condition. So in summary for us, we were obviously excited to see that we didn't impact length of stay on a negative basis, though we were obviously looking for more of a positive impact. But on a real positive side, we had no readmissions with those that agreed versus a couple with those who didn't disagree.